coronavirus spread continues. What's the psychological damage and risk? How can we stay both safe and calm? And the UK's decision to use Huawei in building its 5G network will give Britons the benefits of technology without compromising national security, says Prime Minister Boris Johnson. But not everyone is pleased. Who and why not? Welcome to The Point, an opinion show coming to you live from Beijing. I'm Li Xin. On Monday, a new hospital built in 10 days in Wuhan, central China, began admitting patients. While applauding this feat, a growing dimension of this crisis isn't just the physical risks, but the psychological impact. And social media may be an outlet for emotional release, but rumors and disinformation are also stoking public fears, fueling everything from hysteria and paranoia to racism and xenophobia. So where is the fine line between rational and irrational responses? What can we learn from history about the better ways to react to this epidemic? Joining me via Skype is Dr. Wu Zhiwei from the Center for Public Health Research at the Medical School of Nanjing University in eastern China's Jiangsu province. So Dr. Wu, welcome to The Point. Before we go into the discussion, just a very quick update on the situation. As of 1.5 hours ago today, the number of confirmed cases in China exceeds 17,336, and the number of accumulated death cases were 361, and the number of recovered cases 516, and that's released by Tencent, a tech company, according to data released by China's national health authorities. Meanwhile, as to the cases outside of China, a total of 22 countries across 4 continents have reported a total of 152 confirmed cases of infection, including 1 death in the Philippines, and the 4 continents including Asia, North America, Europe and Australia. Countries include Japan, Thailand, Singapore, the US, Canada and so on and so forth. So Dr. Wu, let me go to you as to the development, the latest development of this situation. Where are we in terms of the curve of the development of the cases? Now that we're seeing more cases, and yet, as I have just said, the number of deaths, especially new confirmed new deaths cases as a result of this new coronavirus, seem not to be growing very fast. Actually, the number of people who have recovered nationwide after treatment actually outstrip the number of the number of deaths caused by this outbreak. How do you explain that, Dr. Wu?
Well, actually, you can see clearly that the new cases are popping up, increasing every day, and apparently the epidemic is still expanding, particularly in Wuhan and the Hubei province. I mean, that says very clearly that the virus actually is highly transmissible, and many people are actually highly susceptible to the viral infections. But based on the deaths so far, we have seen that this virus is apparently not as pathogenic as SARS and MERS virus, so it doesn't cause that much severe cases. So apparently, in terms of the viral harm does to the people, actually it's not as bad as we have seen with MERS and SARS.
At the same time, we are seeing the number of cases still increasing pretty fast. For instance, yesterday we saw over nearly 3,000 new confirmed cases, and the number of suspected cases also rose by a big margin, over 5,000 in the past 24 hours. So exactly what are the factors that can explain the rapid increase of these numbers, and what does that say about this virus?
Well, actually, I think what happened is that if you look at the long incubation period of this virus, you would expect, before before Wuhan was locked down, actually quite a big population, maybe they are already infected, already, left Wuhan, and they went to different cities, different provinces in China, and also within Wuhan, you would expect that a sizable cluster of infected people actually they did not realize they were infected. So those people actually, as an initial population, they would, disseminate the virus. So I think that's what we have seen, that the virus actually, the new infected cases are increasing over the period. But I would, expect in the next 1 or 2 weeks. Let's wait to see what would happen. We hope that the increase of new cases would go down a little bit, and then that actually we could start to see some hopes.
Yeah, well, a lot of people are obviously watching the development of the situation, and anxiety is high. I'm sure you must have also noticed as well, especially we're just living through this Spring Festival holiday period where everybody had a lot of time on their hands. So a lot of posting on the social media, a lot of retweeting, a lot of discussion, and almost every day there's a new theme. Sometimes it's a legitimate one, sometimes it turns out just to be another piece of fake disinformation or even fake news or even rumor. So, Dr. Wu, how do you describe the situation that we're living collectively, we're experiencing collectively at this moment? Have you seen anything like that? Do you think this is normal, that something like this would happen, or is it something really new that we're experiencing in a all-media era when we have an epidemic, when there is still a lot of unknown information, where things are still developing pretty rapidly?
Well, actually, I think it's quite understandable with the new virus. People do not know how it started the infection and how it infects people, and its mortality rates. And there are a number of issues here that people will become panic, and they can they can be really worried about the viral infection. But in terms of the overall epidemic scale, it's a much smaller than annual flu viral infection. But I think the other thing is that the media does play a certain role in this panic and overreaction. As we all know, that the social media may actually disseminate, the false and the fake, all sorts of information so quickly. I would guess, many people wouldn't even think carefully whether those news, whether they are real or not. They just, on their fingertips click and send to more friends. So that actually exacerbates the whole situation, and it's not helpful.
Yeah, some people are actually saying at times like this, we're fighting actually two enemies. One is the virus itself, the other is fear, and in this case, it seems that it's particularly acute. However, many people are also asking this question. I mean, in the United States, for instance, the U.S. CDC, the Centers for Disease Control, estimated that 2019 alone saw some 40,000 citizens die of flu, and 2 years ago the death rate was the worst in a decade at about 60,000. And people are asking why there is no panic in the United States, although both the number of cases of infected cases and the number of deaths were all much higher. How would you compare these two cases, these two different epidemics? Is it fair to put them together and compare them side by side, Dr. Wu?
Well, actually, it's definitely not fair to compare those two. But what really happened is that when people knew that this is going to be an annual event, every year you would expect when the weather cools down, and you would have a flu epidemic, then people are mentally or psychologically well prepared for that. And the other thing is that a lot of people actually were infected previously. They do have certain immunities, and that there are drugs, there are ways of controlling the virus, and a lot more about the virus, the flu infection. So you are mentally prepared. But for a new coronavirus, people have no idea, and that actually feeds feeds into people's panic.
But at this moment, although our knowledge is very limited, it is not zero either. I mean, for instance, we already know that the mortality rate is very low at this moment, standing between 2–3%, and that's only among the cases that have been confirmed to have been infected with the virus. Among the real population, which might have been infected, the mortality rate is actually smaller. So, you know, it's not totally unknown, and yet we are seeing a lot of very drastic reactions. For instance, for some country which totally shuts down its border with China. Is there an overreaction there, Dr. Wu?
I think it's a definite overreaction. If you look at the WHO's guidelines, actually, you know, that doesn't recommend to impose this blanket ban. There are a lot of, you know, public health and epidemiological approach to contain the virus spreading. And I think, you know, countries should exhaust their public health approach before they actually put on the blanket ban, because it just doesn't help to contain the epidemic, and it doesn't help to, you know, to encourage culture and commercial exchange.
At this moment, some people are saying, although that it's better to be sure or safe than sorry, and sometimes you cannot blame other countries or other peoples which go a bit extra in their precautionary measures. So where's the fine line between rational reaction and irrational reaction?
Well, actually, I think you know, it's hard to define rational and irrational, because it very much depends on individual country, you know, the mentality, the size of the country, and their healthcare system, and their, you know, capacity in dealing with an epidemic. But you know, for me, I think a rational approach is that you're trying to find a reasonable, workable public health approach, and trying to do, you know, disease containment, such as, you know, set up border surveillance, and set up, you know, quarantine facilities for those suspect cases. And if that actually goes out of hand, you can't control, then you could, you know, think about some drastic approach. But so far, like in the United States, I mean, there are only you know, a dozen cases. Then you basically taken such a blanket ban. I think I would call it an irrational approach.
All right, thank you so much, Dr. Wu Zhiwei from the Center for Public Health Research of the Medical School of Nanjing University.